Fistula is a debilitating condition that impacts negatively on the dignity of women. In Nigeria, it is estimated that a minimum of 10,000 fistula cases are recorded yearly. In addition to the high fistula burden in Nigeria, availability and quality of data to guide decision-making in the National Fistula Programme has been a big challenge. Assessments conducted by the MOMENTUM Safe Surgery project showed significant gaps related to availability and quality of data, even where indicators were available. Data was missing, incorrectly or inconsistently reported, particularly in relation to fistula repair and caesarean delivery data.
Even the data systems that allows the health managers, the facility managers, the Federal Ministry of Health to, at a glance, visually see information that allows them to make informed decisions on fistula in country was not available. There was no fistula dashboard. We were not getting client-level information for fistula. And so which means that in making decisions around fistula, either in terms of resource allocation, in terms of posting of investments in fistula programs, we did not have enough robust data that was available for decision making.
Following the assessments, the MOMENTUM Safe Surgery project worked with the Federal Ministry of Health and states across the Federation to initiate and implement key approaches that will change the narrative of data gathering, both for fistula programming and caesarean delivery in Nigeria.
So we also strengthen data. Data is critical for fistula. One of the issues we have had over the years was to have a good data set on fistula, and the work that USAID EngenderHealth project has done on data set strengthening, bringing up indicators from the country, and also working with the Federal Ministry of Health to implement capturing of those data and forwarding it to our DHIS2 platform has been, is commendable actually. And I want to appreciate them for such.
I think one key thing where we made significant progress was in terms of working with the Federal Ministry of Health to pool all the data on something called the District Health Information System, which is really the health exchange for the country, where all data for the country is pooled into one database. And now we're able to work with them to extract a dashboard. Now this dashboard shows on a daily basis, on a monthly basis, the number of fistula clients who have been identified, the number of fistula clients who have been cases who have been treated, as well as the number of clients who have been rehabilitated in country as well. And so that meant that at a glance, this government could now begin to see the gaps and use that to advocate, to say, we are seeing 1,000 patients as with fistula, but we're only taking care of 200. So that is such a visual tool to be able to advocate. And one of the benefits of this tool was that it now allowed the government to be able to make informed decisions, both at state level and at national level.
Before the intervention of EngenderHealth in Bauchi, honestly, I must say that all our general hospitals, report their data through the local government data officer. And that has been a challenge, not only in Bauchi State, but across Nigeria. So over time, when we had the presence of EngenderHealth, they trained our data officers at the secondary healthcare facilities. We started with the 6 general hospitals, or rather 7, where Momentum had their intervention. So these data officers were trained, and then they were given access to upload the data directly from the secondary facilities. I must say that after the introduction of this, we realized a great improvement. Initially, we have a lot of issues, ranging from the quality of data and, unreported cases. But this time around, from the time of this training and the time we're given access to upload our data directly from the secondary facilities, there was great improvement in terms of data upload and then the quality of data we are uploading from Bauchi State.
When they came on board, at least they looked around and checked around and looked at the data that we have. Like I said, it's not as if we didn't have any data. But when they came, it was quite all right, a saving grace. And They came, collaborated with us, and brought in areas in training. They had to train in fact, almost all the medical records officers in the facilities that they have chosen, 5 hospitals where they are working. And like I said, they help in the training. There was activities, ongoing activities all around at every point in time. There's validation, data validation that is always ongoing. And then visitation to even the facilities, apart from inviting us for the quality review of data that were collated. They also come around the hospitals, go around the facilities to, at least is as a way of checking what is being done.
One of the things that the MSSFPO been able to do to us is in the area of data management. Even though up to now we're still trying to kind of get it to the optimal level that is required. And what I'm trying to say is that all this while we've been using manual services, okay, where we use the register to record ourselves. And you know how papers can be. Sometimes they get turned off, sometimes we have data missing and all that. So with their coming, we've been able to understand that, look, we need to go back to electronic data management. And that is why presently we actually have a particular setting now where we have our data now, right from our inpatient and outpatient is now electronic now. So we have the electronic data forms.
These interventions have yielded positive outcomes, as attested to by the frontline personnel who handle data in the health facilities.
Before they come on board, we have a data gap in which the services we rendered to patients, they are not documented all. Maybe we have 10 deliveries, 2 will be recorded, and 2 will be the one we will submit or report to DHIS. But with their intervention, we have access, direct access after they train us on DHIS 2. So we have direct access to upload our data timely and accurate. Because before then, even we have the accurate data, we cannot have access to DHIS 2. It's only the MIE officer of the local government that have access to DHIS 2 or NOCA. But with their intervention, we are trained on how to log in, how to upload our data on DHIS 2 and NOCA platform.
As a record officer, I know that the hospital has benefited from a series of training from Momentum Safe Surgery regarding their National Health Information Management System data tools, which is national tool that all the hospitals are supposed to work with for data collection. Momentum Safe Surgery has trained record officers in this facility to know how to document properly in those registers. And also, Momentum Safe Surgery has facilitated and support us in carrying out monthly data review meeting at facility level. It's a meeting that all service providers, the head of unit, in charges of the ward, and medical record officers are coming together to discuss issues related to documentation and data collection. It holds at the end of first week of every month. Also, remarkably, Momentum Safe Surgery has provided a computer system to the facility, which I, as a record officer, am using to report directly from facility, report our data to the state and national level by using DHIS 2.
But now we have the access through the intervention of the Momentum Safe Surgery in Family Planning and Obstetrics, which we have the training in Sokoto. So now we have the access. I am the custodian, I am the MRO who is uploading the data into the DHIS, and now we are able to have timeliness and then completeness, because before we have some errors before you have the access, but now everything is in safe hands. We used to upload our data in time. Any errors that we got before the intervention of the MSC4 has now corrected, and everything is going smoothly. In every end of the month, we used to do a data validation together with our PMO, Dr. Amina, in order to look at the data. Is it complete, accurate, and the validity also. So after we did that, then I will upload the data directly to the DHIS.
While the capacity of medical record officers has been enhanced through these interventions, it is noteworthy that interventions by the Momentum Safe Surgery project have also enabled the use of data for decision-making at various levels.
Well, one important usage, or rather, the way this has impacted positively in shaping the management, or rather the decision making at hospitals management board can never be overemphasized. We had a data that informed us, to know that there is a serious gap, especially in terms of human resource for health. More so specifically the issue of doctors in our general hospitals, which led to working together with other critical stakeholders to come up with a model, interim model to be able to address this gap, which by the support of His Excellency, the Executive Governor of Bauchi State, Gauram Bauchi, has graciously approved our submission based on the evidence-based data we had and submitted to the government, where I can boast that recently using the locum scheme, where we engage the services of specialists, to go and give intervention in specific areas based on the quality of data that we have. And secondly, this data shaped, the utilization of this skilled manpower, whereby telling us exactly who to post at that particular area. For example, I must say that, going through the data that we are receiving directly from facilities informed the committee that is responsible for this to ensure that we get the relevant qualified, medical personnel. When there is more mortality in terms of maternal mortality, we know we need to get so number of, gynecologists, specialists in O&G to be able to go and address if the reason of those mortalities are because of skilled manpower. So we've been doing that, and it has been giving us great improvement. Recently, we used the data that was uploaded in the DHIS, and that data showed us that in 4 months of intervention in these areas, we were able to see a reduction of maternal mortality by number from 25 to 6, which is a great improvement that has never been recorded over a time in Bauchi State.
With that, it has been able to help us to plan, such that now we're able to know at this point, like now we're able to know that we have less of simple fistulas in our hospital. Because even when we have to go and repair that's for those that require surgery, we don't just buy anything. We now try to look at, based on our data, what type of fistula have we been able to get over a period of time. We find out that we do have more of difficult fistulae, complex fistulae. So our resources, 85 to 90% is towards purchasing consumables for that. And then maybe the remaining we can look at it if we have any form of simple fistula that will come in. Then of course, when it comes to budgeting too is also another thing, because when you want to budget, you want to buy at even in the next 1 year or 2 years, with the fact that we have an electronic form of data keeping, it's easier to now go back to the bank of data you have and look at it and say, okay, even as we're planning towards the next season of our fistula treatment, what and what do we need to do? What are the things that are not available?
It is certainly heartwarming that stakeholders have put in place key steps to ensure sustainability of the gains recorded by the Momentum Safe Surgery.
It's very, very easy because when Momentum came on board, they were working, hand in hand with Hospitals Management Board. So they were rather supporting us than doing the activity directly. So most of the staffs that were utilized on ground as staff of Hospitals Management Board, their capacities have been built, and they supported us with some of the laptops in these facilities, which we are still utilizing the trained manpower to continue to upload data directly from facilities. And having said that, this capacity have the capacity, to cascade this training that, gotten from Momentum, so that we have more manpower, skilled manpower to be able to expand. So currently what we're doing, this trained personnel, cascading their training downwards so that we improve the expansion from the number of facilities Momentum supported to be able to cover the whole general hospitals across the state.
Even from the surgical skills, we don't really have to, as such, call Momentum Project now to sponsor any form of training again, because what we've acquired we'll be able to pass down to other people. So you'll be able to have more and more fistula surgeons. And then as part of the mandate that is establishing this hospital is training. And of course, Momentum Project too has been able to impact training. So as they are winding off painfully, we feel very bad they are going, but then that is such is life, they have to move on. For us, we'll continue with that training because it's also part of our mandate. So for those of us that have been trained, we have our training materials, we have our knowledge that we've been able to do. We'll now trickle down to those who have shown interest, commitment, and passion, so that all those things move on from there.